Good morning, I am Dr. Angshuman Mukherjee. I am a pulmonologist in Fortis Hospital, Kolkata. We will be talking about diet in COVID time. So this is a very important and a pertinent topic, I guess, because most of us, when we are treating people, the main question comes from the patient is, what should be my diet in across the board of all sort of patient. Okay, now what is speciality of COVID? COVID is a disease which actually decreases your muscle mass. In our language, it's called Sarcopenia. That means loss of muscle. So you have to eat something which will help you in building up the muscles in proper time. Because if you lost muscle, if you lost the power of your bone, you will be weak, far more weak, which those people who are suffering from COVID or who had COVID, they will tell you that how much weakness they are having this time after COVID, 3-4 months after COVID. So the primary aim is to provide them nutrition, to give them a good health, and to help them boosting their immunity. These are the three main factors we think when we are prescribing a diet. The most important thing is fruits and green leafy vegetables. Do not rely mostly on carbohydrates. Go for fruits, go for green leafy vegetables, go for protein. So these three things are important when you are thinking about COVID diet, both in case of if you are in a hospital or you are in home isolation or you are a post-COVID patient. So this is the important thing. Number 2 is you have to cut down your sugar content, you have to cut down your sodium content, that is the salt content. So normally we give advice to take salt about 5 grams per day and eat as less sugar as possible. So that will give you far more benefit in terms of reducing the obesity, in terms of fighting heart disease, in terms of reducing the comorbidities in COVID also. So these are the type of diet you should remember when you are fighting COVID. Another thing must not to forget is taking plenty of fluids. So if you don't have any fluid restriction from a previous disease, eat plenty of fluid. You can eat 2.5 to 3 liters, maybe 3.5 liters of fluid a day, which will give you proper hydration and which will reduce your weakness in due course of time. Thank you.